अपने स्वास्थ्य की जिम्मेदारी and today is a very special day for many reasons. I think in the past so many years हमारे साथ एक या दो सर्जन ज्वाइन किए हैं, एक बार पाइल्स के लिए या एक दो सर्जन हमारे साथ बहुत कम जुड़े हैं, क्योंकि सर्जरी का नाम सुनते ही एल्डर्स डर जाते हैं, ऑपरेशन नहीं कराना. So today we have a very humane surgeon, Dr. Arun Prasad, a dear friend of mine from the Indraprastha Apollo Hospital, a distinguished academician, a teacher, and one of the country's leading surgeons who's dealing with obesity. He heads the International Obesity Organization and is placed in the Indraprastha Apollo Hospital. अब आज की चर्चा जो है एल्डर्स की ओबेसिटी के बारे में. अब बहुत कम लोग समझेंगे कि एल्डर्स की ओबेसिटी क्या होती है. So I think let us run a small poll before we go into the topic. I'll stop sharing. Pragati, you can please bring on the poll. Arun, have we lost you? Dr. Arun Prasad?
No, I'm here.
Okay.
Yeah, I'm here.
So please, ध्यान से पहला क्वेश्चन पढ़िए. Factor most strongly contributes to obesity-related functional decline in health. Elders में obesity कौन सा फैक्टर है जो सबसे ज्यादा फंक्शनल डिक्लाइन को इफेक्ट करता है? Reduced metabolism, age related appetite, या inflammation. ये चार फैक्टर्स हैं जो कि ओबेसिटी में एल्डर्स को बढ़ाते हैं. आपकी सोच में कौन सा है? You have your another about 10 seconds to answer. Okay, right, Pragati. Next question. Next question, please. Okay. In elderly people with obesity, elders जिनके अंदर obesity है, which complication is most closely linked to increased fall risk? Obese है, इन चार में से कौन सा आइटम ऐड करता है उसको फॉल्स के रिस्क को बढ़ाने के लिए? Very nice. This poll is only to give an idea to our expert speaker as to who he is dealing with. बेटा ये दरवाजा बंद कर दो जरा. And Dr. Prasad, you will realize कि हमारे elders बहुत knowledgeable हैं. 5 साल से पढ़ा रहे, इनको knowledge तो बढ़ ही गया. Okay, Pragati, third question. So most people feel osteoarthritis and muscle weakness with obesity. So third question, what is the most appropriate goal of obesity management in older adults? आप क्या समझते हैं कि एल्डर्स के अंदर अगर हम ओबेसिटी ट्रीट करते हैं तो सबसे बड़ा गोल कौन सा है हमारा? क्यों हमारा, व्हाट इज आवर एम? Rapid weight loss, cosmetic, preservation of mass and muscle mass, or strict calorie restriction? Very nice. Very nice. We've got a response from about 30 people, 24. Very nice. So another 10 seconds. Let more people participate. So most people feel preservation, मतलब मसल मास को प्रिजर्व करने में सबसे ज्यादा गोल होगा. Very nice. Last question, please. Pragati, last question. Which intervention का मतलब कौन सी चीज हम इंटरफेयर करें is considered essential when prescribing weight loss in elders में अगर हम weight loss कहते हैं कि weight loss करो, कौन सा इंटरवेंशन है जो कि सबसे ज्यादा अहमियत रखेगा? फास्टिंग, एरोबिक एक्सरसाइज, या रेजिस्टेंट ट्रेनिंग विद प्रोटीन इनटेक, या जो भूख को मारने वाली दवाइयां हैं? भूख को मारने वाली दवाइयां आजकल आज टीवी पे बहुत चर्चा हो रही है. So most people feel resistant. रेजिस्टेंट ट्रेनिंग का मतलब होता है हाथ में वजन लेके उसके साथ एक्सरसाइज करना और प्रोटीन इंटेक बढ़ाना. मोस्ट पीपल फील दैट. ओके, नेक्स्ट प्रगति. प्रगति नेक्स्ट प्लीज. ओके, लास्ट क्वेश्चन. यंगर एडल्ट्स में कंपेयर करो. ओबेसिटी द एल्डर इज मोर स्ट्रांगली एसोसिएटेड विद व्हाट कंसर्न? यंगर जनरेशन और एल्डर जनरेशन में. Very nice. So, Dr. Prasad, you have a very knowledgeable audience.
Thank you.
तो आपका टास्क उतना मुश्किल हो जाएगा. Okay. Right. So I think that is a fairly good. Let's end the poll. So I pinned Dr. Arun Prasad. Thank you very much, Dr. Prasad, for staying with me. Let me tell all the elders, he's at the airport, but still considering us. Thank you so much, Arun.
Thank you. My picture is not visible, so I will just show you my logo here and get on with the
that's right.
Presentation.
Thank you, Arun. Thank you for sparing your time. And with such an important topic, elders, कई लोग सोचते हैं, यहाँ पे मैं शेयर करूं कि उम्र होगी मोटे तो होते ही हैं. ऐसा नहीं. आज आपको डॉक्टर प्रसाद बनाएंगे. Being elder and being obese is not the same thing. We can see your slides, Dr. Prasad. Dr. Prasad? Disconnect हो गया. Okay. Your voice is not audible. I can't hear you. Dr. Prasad, there is an audio problem. Your first slide is visible. He's trying. Okay. Your audio's got disconnected, Dr. Prasad. आज एल्डर्स को ज्वाइन करने में तो कोई प्रॉब्लम नहीं हुई जैसे लास्ट टाइम हो रही थी. Did anybody have a problem joining today?
नहीं सर, नहीं, ठीक था.
Gupta ji.
Only thing is I didn't get the message. So you said to me.
GREWAL.
Yes, please.
May I say something?
Yes, please go ahead.
Sir, under your supervision, this webinar is going from the last 2 or 3 years.
Sir.
And every week we increase the knowledge by 10%. And
Right.
a year it is 500% increase in the knowledge. And in 3 years, 1500% we increase the knowledge. Thanks to you and salute to you.
So nice of you. So nice of you.
Yeah.
Thank you so much. Thank you so much. It is a great feeling to see that elders are
Is
feeling.
my voice better? Is my voice better now?
Yes, better now. Now we can hear you, Arun. Please go ahead. Yes.
Okay.
Okay.
So moving forward, we are looking at a global growing health challenge which impacts morbidity and quality of life. It is associated with metabolic and functional decline, and also it requires age specific management. So it's not one bullet that kills all. So then we are also looking at multiple aspects which affect this visceral obesity. So visceral obesity is affected by increased age, male gender, the race, liver, there is adipose tissues, and there are a lot of hormonal changes also which are important. And so it's a multifactorial. Even as you see on the right upper quadrant, you'll see low income, poverty, poor in education, malnutrition. So malnutrition can sometimes lead to obesity when you become old. And how all this happens, I will tell you in the next few slides. So the epidemiology and the trend shows that there is a rising prevalence in adults over 60 years. The urbanization and sedentary lifestyle are the key drivers to this rising prevalence. The longer survival with chronic disease. So our age expectancy is increasing. So naturally we'll have more older people, and so the percentage of obesity in old will automatically increase. Often this problem goes under recognized. And there is also a difference between the Asian people and the Western people. So here is an example. Now this is an endocrinologist. On the left, you see this is a Canadian endocrinologist, and on the right, you see is a Pakistani endocrinologist. They both are of the same age and same BMI, which is 22.3. However, when it comes to body fat, you can see that the Canadian has 9% body fat, while the Asian has 21.2%. And this is confirmed on the scan, which you can see. So what this shows that you can have different visceral fat for the same BMI. On the left, you see more healthy fat, and on the right, you see less healthy fat. And again, this is a scan which shows how there is more visceral fat, a problem that is commonly seen in Indians, where you have a pot belly, but you may not be obese otherwise. And so at the same BMI, Asian population have a higher percentage of body fat than Caucasian population. So you see the Asian there and the Western there, how the Asian has more visceral fat and less muscle mass, while the same BMI, the Western person has less visceral fat and more muscle mass. So this leads to age-related body composition changes. So loss of muscle mass, which is sarcopenia, is a very important factor and a very important problem that is faced by the elderly in India. This sarcopenia means there is an increase in visceral fat, reduced metabolic rate. The fat redistribution, it actually raises the risk of cardiac problem and also neurological issues. So sarcopenic obesity is defined as the co-occurrence of obesity and decreased muscle strength. So you have somebody who has fat but doesn't have muscle. So this sarcopenic obesity is often observed in older adults and may be associated with a decline in mental ability.
Beautiful.
So it can also lead to cognitive impairment and dementia amongst the elderly. So there is a functional impact. So because of the sarcopenic obesity, there is reduced endurance and gait speed. People walk slowly. They have problem with the balance. They have difficulty in daily activity. There is higher dependency on people and on aid. There is an increased hospitalization risk in these people, and the health consequences are tremendous. These people are more liable for diabetes, hypertension, and dyslipidemia. And again, the osteoarthritis and the mobility limitation is there. So on one hand, you have joint pains, and on the other hand, you have weak muscles. This leads to frailty and risk of fall.
What is
There could be.
dyslipidemia?
So dyslipidemia means basically something like cholesterol problem. You know, people who have high cholesterol, high triglyceride. Indians, we have a lot of problems with high triglycerides or high fat in the bloodstream, and that affects the diabetes and hypertension, and that is again a common problem which comes in with along with the obesity. Sleep and respiratory issues like snoring, which leads to less oxygenation of the brain. Cognitive and mood effects are there. And the obesity in the elderly, what happens that this obesity increases hypertension, atherosclerosis, stiffness of the blood vessel, causes problems with the lining. And this can be countered by exercises, which you see on the right side. Then there are challenges with assessment. How do we assess somebody's obesity? Because BMI might underestimate fat. The waist circumference here is something which is very important. So even if you have somebody who's not overweight but has a large waist circumference, is at risk for cardiac and neurological issues. Then we need to assess the muscle and the function, and also include nutrition screening, because you may have somebody who's fat, but if you start checking their blood test, you will find they have deficiency in iron, vitamin D, B12, protein, etc. So how are Indians different from others? So firstly, Indians are different because they have central obesity, which is increased waist circumference and increased waist to hip ratio, even without being overweight. Then we have the thin fat. Thin fat are people who have sarcopenic obesity. So you'll see people who are otherwise thin, but they have a big tummy outside. And this increases the risk of heart and cardiovascular problems. Then this also leads to IR. IR stands for insulin resistance, something which Dr. GREWAL treats, which is increased plasma insulin level. And this high level of insulin resistance means the body is producing insulin, but it's not working. So people are getting diabetic. Then we have LDL, which is what I meant about dyslipidemia, high LDL cholesterol prevalence, and low in HDL. HDL is a good cholesterol, and many people have low HDL. So when we talk about obesity in elderly Indians, you have high visceral fat at a lower BMI. The metabolic risks begin earlier. So somebody in the West might have a problem with 35 BMI, but the same problem come to us at 30 BMI. The refined carbohydrate dietary pattern. Now, this is something which you see all over India. We Indians love refined carbohydrate diet. Without refined carbohydrate diet, we feel कि खाना तो हुआ ही नहीं. इसके बिना तो खाने से क्या फायदा? इससे मतलब मैं जिंदा ही ना रहूं जब तक कि मैं अच्छा refined carbohydrate नहीं खाऊं. The lower muscle mass risk is there in elderly Indians, and the Indian BMI and waist cutoff should be used when we assess these elderly Indians. When we come to management, there are certain principles that fat loss should be there while preserving muscle. So people go on diet, starvation diet, intermittent fasting, various types of diets, and they lose weight. But what happens? They lose muscle mass along with the fat. And that is a very dangerous thing to happen. So whenever you are going on any diet plan, make sure you have enough protein in your diet, do enough exercise, as Dr. GREWAL was saying in the beginning, and in the MCQ also you saw resistance exercise. That is very crucial, because after that, if you regain your weight, you will only regain fat. Regaining protein is very difficult. So adequate protein intake is very important. Resistance and balance training, as most of you have correctly answered in the MCQ. Gradual weight reduction, very crucial. Don't try to lose weight suddenly, because you'll not maintain it and you'll regain it. Multidisciplinary care, it's not just a medical surgeon, it's your nutritionist, your physician, endocrinologist, psychologist, everybody has to be involved. There are 3 pillars which support obesity management. On the left, you can see the psychological and behavioral intervention. In the center, pharmacological therapy, as Dr. GREWAL was mentioning, which is our Manjaro, Ozempic, Wegovy, which we have these days. And on the third, the last option, which is bariatric surgery, which is a good option for obese in the younger age group. But how good is this and is it indicated in elderly is something we will discuss towards the end of my presentation. So there are medical and surgical considerations. Polypharmacy awareness should be there. Adjusted caloric goals, selected bariatric options, and it has to be individualized. Each person has to be individualized for the risk and benefit that could take place. Functional outcome has to be focused at what are we going to gain by losing weight. So that outcome is very crucial. So obesity in older patients is weight loss surgery an option. Now here, the important point here is that the biological age and frailty matters more than chronological age. That is what we need to see. And there are various scans and investigations to find this out. Muscle mass, bone health, and nutritional reserve must be evaluated. If the person does not have good muscle mass, bone health, then doing bariatric surgery in these people can be a disaster. Goals emphasize mobility, independence, and metabolic stabilization. So this is what we want from bariatric surgery. We are not here to create Deepika Padukone-like models here. We are here to improve your mobility, independence, and stabilize the metabolism. So which procedures? When we talk of bariatric procedures, the safe bariatric care in elderly focuses on physiological fitness and frailty rather than chronological age, as I mentioned. So laparoscopic sleeve gastrectomy is a simple bariatric procedure which is often preferred due to shorter operative time and predictable recovery. We have gastric bypass procedures which have to be carefully selected in metabolic high risk elderly patients, but we have to be extremely careful to select the right person. Then there are endoscopic procedures. Also, there are gastric balloons, which are all temporary, minimally invasive procedures for modest weight loss, like about 10 to 15 kg. Then we currently keep talking about robotic surgery. I am a robotic surgeon, so I'll not finish any presentation of mine without talking about robotic surgery. So robotic surgery has enhanced 3D visualization, greater instrument stability, reduced tissue trauma to reduce bleeding and post-operative stress, better access in obese. So all these safety features of robotic surgery makes it even a good option for elderly. Low complication and conversion rate is another great factor here. So when we talk about robotic bariatric surgery, I will show you a short video. I will not show you full video. I'll just show you a partial video of how robotic bariatric surgery is done. Now this is somebody who's 270 kg and he is being anesthetized in our operation theater. That's me sitting at the robotic console. And from here, I control the instrument and do the surgery. So this is, a very personalized setting which is there. And here we use our eyes, hands, feet to do complex procedures. So we look inside this, which gives us a three-dimensional vision. These are the finger controls, which controls the instruments. I will just show you that. These are some foot controls with which I control the energy, the telescope, change between instruments. So a lot of advanced work happens with my foot controls also. So it's basically actually like driving a car where your feet does different things, your hands does different things, and your eyes do different things. This is what are the robotic instruments. So I will show you one of these instruments which goes inside the tummy. And if you look at the tip of the instrument, how this robotic finger moves in 360 degrees, something which human fingers cannot do. And this 360-degree movement of the robotic finger is what gives us the extra versatility, extra grip, extra safety. And how does the surgery take place? Now, this is what we call as preparing the patient. We are getting the person ready for surgery. We make small holes inside the tummy through which our instruments are going to be introduced. So first of all, we need to introduce our telescope. So this telescope which goes inside is going to give us a view everything inside the tummy in a three-dimensional manner, which we will see on the screen. And this is what is the robot. It has got these 4 arms, which will get connected to 4 instruments, as you will see in the next few seconds. So this is how it is showing that the bariatric surgery is in progress. The instruments are all inside the tummy, and I am sitting at the console there, and I am controlling how the movements of these instruments are taking place. So to conclude, I would like to say obesity presents differently in older adults than in younger people. As we age, muscle mass tends to decrease and is often replaced by fat. So someone's BMI can be misleading in older adults because it doesn't distinguish between the muscle and the fat. BMI has its limitations in the elderly. Reduction in height due to spinal compression and osteoporosis and muscle loss can alter BMI calculations, making it both underestimate or overestimate obesity if used alone. Waist circumference can be a useful additional measure, as I had spoken earlier. Obesity contributes to many chronic diseases and physical disability. It's linked with increased risk for diabetes, hypertension, cardiovascular disease, high cholesterol, and strain on joints. Associated with more rapid decline in cognitive functions such as memory, comprehension, problem solving, which can further impair independence and satisfaction. Planned supervised weight loss can still offer benefits, although weight loss in elderly results in some muscle mass loss. Moderate intentional weight loss can improve inflammation, blood pressure, cholesterol, and blood sugar if done safely with diet and exercise. So before I say thank you, I would like to say the elderly deserve a good, healthy, mobile life. You have worked all your life, and now with your savings, when you want to enjoy your life, you want to see the world, you want to go around, you should not be restricted by obesity. And the best way to manage obesity is to prevent obesity. And if at all you do get obese, you have the choice of first doing something with your diet and exercise problem. Medical and surgical management are there for some of the options where other things won't work, but most people should be able to manage preventing obesity by taking a high protein diet with low carb and doing resistance physical exercise. Thank you very much. If there are any questions, I would be happy to answer.
Beautiful, beautiful. Thank you, Arun. Could you stop sharing, please, so that we can get?
I'll stop sharing and I will join from my phone.
Okay, okay, right.
I will quit my laptop.
Right.
And join from my phone.
Okay, right. Right. So I think what is important for you all to understand, very common complaint of the elders, very common complaint. डॉक्टर साहब हम बहुत अच्छी तरह खाते हैं, सब चीज खा रहे हैं, बहुत डिसिप्लिन लाइफ लेते हैं, योगा भी करते हैं, लेकिन थकावट बड़ी रहती है, शरीर थका पड़ा रहता है. I think how many of you will agree that this is a very common complaint that the elders have? थकावट बड़ी रहती है. And where is that coming from? What you learned today, most importantly, that एनर्जी की फैक्ट्री आपका मसल है. आपके जो पट्टे हैं, मसल्स हैं, एनर्जी वहां बनती है. तो yes, please, Arun, I like to just pin you with us. Yes, Arun. So
yes, is there a question?
Yeah, no, I'll just introduce that. You see, so सबको पता लग गया है कि source of energy, place of energy production is your muscle. Now, obesity जब आती है तो चर्बी, फैट जो है वो मसल को छोटा कर देता है। और अगर हम वजन अकेला करें या बीएमआई करें तो हमें पूरा इंडिकेशन नहीं मिलता। So that is what is to be understood. Yes, Mr. Batra, I'll read out your question to Dr. Prashad. If BMI is the right measure of obesity, what is the right measure for
Not
elderly?
correct.
No, BMI is not the right measure.
Yes,
Yeah.
BMI is not
Then
the right measure.
what is the
Yes.
measure? How do I know that I require doctor intervention now? I
Right.
need to
Okay,
measure
so-
some different
sure.
parameters.
See, one is this BMI analysis machine, which is available, I think, in most hospitals, most OPDs, even at gyms. And that actually tells us your percentage body fat and percentage muscle mass. So if your muscle mass is low and percentage body fat is high, then even at a lower body BMI, you are at risk. And the reverse is
Good.
also true. You will see wrestlers who are very heavy, but they have a lot of muscle mass, but their percentage body fat is low, so they will not be called obese. Similarly, another thing which I mentioned was your waist circumference. So your ratio of waist circumference to height and ratio of waist circumference to hip. So these are two other good parameters. And apart from that, there are chemical parameters. You know, if you have insulin resistance, if you are diabetic, if you have cholesterol issues, so that also puts you at a risk. So it's a overall picture which we have to see. And just because an elderly is overweight doesn't mean that he has to do something about it. And similarly, just because an elderly is not overweight but has many other factors, he will have to do something about it.
Gee, anybody else for any?
What are the indicators, sir?
Okay. What are the indicators? Repeat, Mr. Batra.
See, for a common person, without going to physician or a doctor, how does he know that my BMI is still I'm obese, I'm not obese? How do we know?
Yeah, so that's exactly what I was trying to say, no? That we need to see your percentage body fat and percentage body mass. If the body fat is high and your muscle mass is not high, then you will fall in the category where some action will have to be taken.
So the body analysis, Batraji, body analysis is more important. Another question, can decreased muscle loss be regained?
And Dr. GREWAL, the simplest thing is measure your waist circumference and do a ratio of waist circumference to height. That is the simplest thing.
What is the ratio?
So it should be less than 0.9.
Your waist should be less than 0.9 of your height.
No, sorry.
Chest.
No, sir.
0.4.
Sorry, come
So if
again.
your height is 120 centimeters, if your
Yes.
height is 170 centimeters, your waist should be less than 85, less than half. That's the simplest way to measure.
It should be less than half, the waist. Can
That is what
decrease
is okay
muscle
with
mass
me.
be regained? Dr. Prashad,
Can
can
decrease muscle be?
regained?
Yeah, so yes, it can be, but that is extremely different.
It can be regained.
Yes.
Yes, it will be regained, but it's very difficult.
Right. Ji Goel sahab boliye.
Because it requires a lot of high protein diet and it requires exercise accordingly.
Ji Goel sahab boliye.
Bottles.
This weight training is not known nowadays. In every mohalla there is a gym, and it was not there earlier. Now everybody is becoming conscious. So, but elderly people don't go to that gym because they always fear, "Arey, we have never done. Why should we go?" That's the whole problem.
नहीं गोयल साहब एक और बात है. When I tell elders, they turn around say, भाई हमने कोई पहलवानी थोड़ी करनी है.
That is the whole they should understand.
Yes.
It is not palwani. It is only keeping their muscle strong.
Shad is saying, maintain your muscle strength.
Correct.
That is very important for elders.
Yes,
बिकॉज अगर आपका मसल स्ट्रेंथ मेंटेन नहीं है तो आपकी एनर्जी कमजोर है तो आपको कॉग्निटिव डिक्लाइन जल्दी होगा. नाउ यू सी हाउ थिंग्स आर वर्किंग आउट. पीपल हु आर सेइंग कि हम तो योगा करते हैं बट दे डोंट हैव अ मसल मास. इफ यू
correct.
डॉक्टर प्रणॉय ने कहा था that yoga is exercise only of the mind, not of the body. People say, Dr. Harvinder, welcome. Yes, any other questions, please?
So one can I make one point there?
Yes, please, go
Can you
ahead.
hear me?
Yes, yes.
So when we talk about muscle, muscle also is an important target or an important place where your glucose from the blood gets taken in.
That's right.
So if you have more muscle mass, your glucose is going to go down. So one advice which I will give, one tip if you forget about my entire talk, but please remember one thing, that is after every meal, go for a 15 minutes walk. It doesn't have to be a brisk walk. Just a normal walk will ensure that the sugar, the blood glucose goes inside your muscles, and that will lead to better control of both your insulin resistance, your diabetes,
But
and
my
will help in
my
the obesity.
suggestion is
So
my
just that's
suggestion is to have a stationary cycle in the house, and you can do cycling after every meal. You don't have to go out. Even in winter, I keep a cycle, and that you can do. As far as the
uh,
gentleman says that you must walk every after every meal.
Dr. Harvinder Singh is asking, what should be the ratio of waist circumference to the chest?
Point one.
no, no. We don't talk about chest.
We
It's
don't.
waist circumference is only compared with either the height or the hip.
No, no.
Right or the hip, not the chest.
No.
Dr. Harvinder, you got your answer? Right. Any other
No,
question? Any other question, please? I think what is important is elders to accept that obesity can be a big challenge for them in their quality of life for two reasons. It not only आपके घुटने को भी प्रॉब्लम नहीं करता, सिर्फ सारे सारे लोग कहते हैं मोटा हूं इसलिए घुटने. नो, it is your brain also that gets affected. And Dr. Prasad, how often have you in the past, say 1 year, operated upon a person who's beyond 70 years for obesity?
Very rare.
Very rare.
So I
So,
would say one per year or something.
and
We are extremely selective because most people are sarcopenic, and if I do
that's,
surgery in a sarcopenic person, you will end up with more problems.
that's right.
So better to prevent these things. And one more point is dependence, because as an elderly, one thing which we hate is dependence upon our children and other people around us. And obesity makes you dependent.
That's right. So just imagine, even though surgery का ऑप्शन अवेलेबल है, लेकिन उनके मसल मास में इतना कमजोरी आई होती है कि वो ऑपरेशन कामयाब नहीं होगा. तो एक डबल वैमी है कि
Yes,
ऑपरेशन,
quite right.
दैट ऑपरेशन दो इंडिकेटेड हम नहीं करते. यस, somebody has raised the hand, please. A voice. How to regain muscle mass? Yeah, somebody has raised the hand, please go ahead.
So can you please once again tell the ratio of height is to the waist or whatever you mentioned?
Dr. Prasad, once again, the height and waist ratio, please. Dr. Prasad? Yeah, Dr. Prasad, the height and waist ratio is being asked again.
Yes, sir.
Yeah, please.
Sorry, I didn't get the question.
It's a repeat question. What is the height and waist ratio?
ये
Sorry?
इंदौर का हो गया शुरू.
Acha, unka loading. So height and waist ratio, please. We won't bother you after this.
Yeah, sorry. Yes, what was the question?
Height and waist ratio.
Yeah, so it's different in women and men. So height and waist ratio should be less than half is what I just, a ballpark figure, but
Right.
actually it goes down to 0.45 and things like that. But if your waist is more than half of your height, then that's a red flag.
That's good. I think that satisfies most of the questions. So I think we'll leave it at this today. Dr. Prasad, thank you first of all very much for sparing your time despite being on the airport and taking a flight. But it was very educative. Obesity की आज तक चर्चा नहीं की हमने. It is the
डॉक्टर
first.
ग्रेवाल, आपने मेरी कैलोरीज बचा दी, क्योंकि मैं लाउंज पे बैठ के देख रहा था और मैं कुछ खा नहीं रहा था. So actually helped me with my calories. Thank you.
Thank you. No, it's important because आज तक हमने, this is the first time by just coincidence Dr. Prasad से बात हुई मेरी. I want to carry this forward because obesity management in elderly कभी सूझा ही नहीं. To tell you very frankly, it was Dr. Prasad's offer that I want to speak on obesity. It is so important, I've just realized. Your knees, your brain, your existing diseases can all be managed अगर आपने obesity अच्छी तरह manage की. And sarcopenia. Next week we are going to have a lecture on sarcopenia. And after sarcopenia, I'm going to try and bring Dr. Prasad and Dr. Harjeet Bhatti together and talk about sarcopenia and obesity in one talk. Because
Great.
this has been very, very important. एक अगर intervention आपके हाथ में है, and that is manage your obesity. Please don't depend on your food because BMI is no more, he said. Fat content कितना है आपका? आपके muscle की strength कितनी है? जो कि I don't. Yes, Mr. Gupta, please go ahead.
Just this regarding height and weight ratio again.
जी.
Height we measure in centimeters.
Yes.
देखिए,
Yeah.
आप किसी भी चीज में मेजर कर लीजिए. अगर आपकी हाइट इंच में है तो आप वेस्ट भी इंच में मेजर करिए. एंड बेसिकली योर वेस्ट शुड नॉट बी मोर देन हाफ योर हाइट. अगर हाफ ऑफ हाइट से ज्यादा है तो ये रेड सिग्नल है. दिस मीन्स यू नीड टू go for further, BMI analysis, various other things.
Okay.
Even though your BMI may be normal.
Yes,
कहा था
yes.
4 बजे शुरू होता है हर
That's
फ्राइडे
थोड़ी आपने थर्सडे बोला था.
फ्राइडे बोला था यार पता नहीं.
okay. So I think let's close here. Ji, Harvinder,
They are one day. Somebody is one day late.
yes, Harvinder, please.
सर ये हाइट टू हिप रेशियो तो आ रही. एक और सर ने रेशियो बोली थी, हाइट वेस्ट टू हिप रेशियो बोली थी शायद सर ने, जो 0.9 थी. दैट वाज 0.9 आई सपोज.
Yes, waist to hip.
ओके, थैंक यू सर.
So I think before Dr. Prasad goes, once again, let's thank him by saying our slogan again.
Thank you very much, sir.
Please, all of you join me in loudly saying and wishing Dr. Prasad a happy journey flight. Let's all together take